Who takes better care of the elderly, Americans or Japanese? The elderly by definition is anyone past the age of 65. This is a general definition that is found in many countries. Japan and America are no different. Both consider the definition of elderly to be anyone past the age of 65. The care that is given to anyone past the age of 65 depends on what health conditions they have or don't have. Many elderly have many comorbidities, and this affects what kind of health care they get and who gives it in both Japan and America. The basic question is, does Americans or Japanese give better care to the elderly? On an individual basis, it would appear that the Japanese give the elderly better care, but with how Japan's economy has taken a turn in the light of the tsunami and earthquake, this is not necessarily true. In the early 1980s and 1990s, Japan prided itself on keeping their elderly at home with the cared for by the daughter and daughter-in-law. But recently, the elderly mothers seem only to prefer their daughters over their daughter-in-laws to care for them. This is because since they are their mother and they seem to care more for their mother, they would take better care of them than a daughter-in-law would. Most women are working as well as men, and this causes a great deal of stress in trying to care for the elderly family members in the home. Most need a 24-hour care, and with most women working, this causes a financial burden. So in the 1990s, early 1990s, there were a sudden trend of the elderly going to the nursing homes in Japan. This was due to the Japanese program that was called the Gold Program. This program was sold to the Japanese people as why not let the trained staff care for your loved one 24 hours a day, or we have trained staff to care for your loved ones 24 hours a day. Since most people now had to work in Japan, they were willing to go with this program. Before too long, there were problems with the program. There was not enough trained staff. At first, the Japanese government thought they could just get through the loss of trained staff, but it soon became more than they could handle. There are long waiting lists for both nursing homes and home health, which have caused resentment of the caregivers of the elderly. This has caused a rise in elderly going to homes, but the nursing staff have more elderly to care for and less time to care for them, and many are getting neglected. Now with the tsunami and earthquakes, the Japanese government is asking for help from healthcare workers all over the world to come and help care for the Japanese. The care was initially asked for regarding the immediate dangers that were going on and for the people who are injured. Then they realized they needed care for the elderly. Many of the families are trying to put their lives back together, and they don't have the ability to care for their loved ones 24 hours a day. Many of the elderly were home alone and carried away with the storm because their families were at work and not home to help them get to safety during the tsunami. The ones that are left are staying in shelters. Many of the homes are unusable, and they are staying where there is hot food and water. They are trying to stay warm, wrapping up in blankets and hoping they don't get sick. One problem was found that 128 elderly people were left alone in an evacuation zone that was surrounded by a nuclear reactor. They found most of the elderly were comatose and that 14 of them had died. Another area found that 11 old people were found dead in a retirement home that was in a flood zone. They were left alone, and with temperatures dropping at night, they think they died of hypothermia. These stories are painful and hard to hear, but is a reality for the Japanese people and those who care for the elderly. With family and supplies running low, it has become survival of the fittest, and usually the elderly are not the fittest. They are usually the forgotten. As for the elderly in America, there has been much discussion on how to care for the elderly. With the baby boomers starting to retire and add more and more people to the elderly population, this has become a concern of the government and people all over the United States. Many of the people are trying to care for their elderly parents without putting them in nursing homes. But there are many things they just have to pay out of their pocket. With the rising cost of food and gas, this is taking a toll on their children, and families are trying to keep their parents as independent as possible, but with the economy as it is becoming harder and harder. The government programs that once existed to help the families keep their loved ones at home have gone away. They have been cut or run out of funds. The average family spends $200 a month out of their own money to help care for a loved one to stay in their own home. Many of the loved people are having financial hardships. This is making the dilemma harder. Do we keep our loved ones at home or put in assisted living, which can cost as much as $35,000 a year, or put in a nursing home, which can cost up to $65,000 a year? Assisted livings are becoming the new trend for the elderly. They can live independently of their loved ones. but have some supervision that doesn't require the loved one to be there. The elderly in the nursing homes have dropped, and many think the assisted livings are the reason. The elderly with the advancements of healthcare are able to live on their own longer, but still need supervision. Therefore, they do not qualify for nursing home care. The qualities of the staff at assisted livings are the question now. Many of the staff are not well trained as in a nursing home. There's a nurse only there part of the day and only care staff there the rest of the time, and they have very little medical training, if any at all. Many of the care staff isn't certified or state tested as a nurse's aide are in a nursing home. The usual routine for assisted living is to send people to the hospital if there's a problem. The nursing homes treat at the nursing homes, so this means no hospital stay. If the elderly go to a hospital, this causes many of the other complications, that the elderly get disoriented and people think they're confused and don't think they can care for themselves. The hours or days spent in the bed at the hospital make it difficult for the elderly to go back to assisted living without more and more care, and this can cause more of a financial burden on the family. Most assisted livings are private pay, and everything other than basic room and board is a la carte, and you have to pay for them separately. This means the elderly are using up their savings to stay where they are. Many families are trying to keep their loved ones at home despite the rising cost of gas and food. Many are now becoming blended families and keeping their loved ones at home with them because it can help with the cost of living. If they move into their parents' home, which is usually paid for already, they don't have that mortgage payment, and most elderly don't eat that much, that the food bill will go up, but only a little. This will help both sides of the family. The elderly has someone there to supervise, to cook their meals, see that they take their medicine regularly, to notice if there's a change, and that they may need to see a doctor. Families are benefiting on both sides of the dilemma in most cases. The problem lies if the care becomes too much for the family, the changes would cause a major disruption of the family. If an elderly person becomes too much for the person to care for and has to go to a nursing home, the insurance only pays for so long, then they want them to go private pay or apply for Medicaid, which means the family has to sell the home and move out and start all over. Caring for the elderly in both countries is a big dilemma. Both countries have their problems with caring for the elderly. It seems the roles are reversing in the care of the elderly with each country. Japan used to care for more of their elderly at home. With the recent changes, they are going for more nursing home care. United States, on the other hand, is going for more care to be given at home. Just a few weeks ago, the governor of Ohio gave a speech about more people should use at-home care services to keep their loved ones at home. He is shifting money that is supposed to go to nursing homes to home health care, so more people will stay at home and save the state millions of dollars. Is this the best solution? Only time can tell. The elderly either way will need care from the health care system, whether at home or in a nursing home. With the regulations of nursing homes by the state, nursing homes are giving better care to the elderly than a few years ago. Most nursing homes are owned by corporations now, not individuals. The laws are going towards better nursing home care. We are spending billions of dollars a year on the country, as a country, to take care of the elderly, either to care for them in or out of their home. The country is taking better care of the elderly as a whole. There still will be your occasional story of elderly abuse, but that is more in the home now than in nursing homes. The caregivers get stressed out and don't know of the options that are out there. And hopefully that will change with more and more education that is being given out and with the use of internet. There are organizations that protect the elderly, such as Adult Protective Services. They check on the elderly regularly, and if there is suspected abuse, they remove them from the home. These organizations make it safer for the elderly to stay at home and get good care. In Japan right now, they are trying to recover from the devastation from the tsunami and the earthquakes, but the country will always pulls together in times of need, and the country and the elderly will soon be back on track. The United States has never been thought of as a country that gives good elderly care because we don't keep our elderly at home, but that is changing. More and more Americans are keeping their elderly loved ones at home. The tides seem to be turning in elderly care for the United States. We are giving good care to our elderly, and is now starting to show. Japan was on the rise of more and more nursing homes and less elderly taken care of at home. Therefore, it seems the Americans are giving the better care to the elderly as a whole than the Japanese. This idea was reversed a few years ago. Now it seems Americans are on top of Japan in elderly care.